So I think it's critical that in your endoscopy unit you have hemostatic powders available for emergency situations. Why is that when there are other forms of potentially cheaper hemostatic modalities available? It's because there are situations which occur out of hours, which are technically demanding to an extent which the practitioners available out of hours are not able to provide. Maybe those people are not standardly doing interventional endoscopy procedures, maybe they're not so experienced with modalities of upper GI hemostasis. So in all those situations, hemostatic powders are our ideal modality to deliver effective and safe treatment for the patient, which temporizes the situation, makes it safe, and allows you to come back, often in daylight hours, because those other situations were in out of hours, to perform your hemostatic modality of choice in a calm environment where other practitioners, potentially interventional radiology and surgeons, are also available should the procedure not go as planned. So a hemostatic powder can be applied in a situation where you have a lot of blood around, there's potentially something bleeding at a good rate, and you want to control the situation and bring the patient back for a definitive endoscopic hemostasis procedure at a later point in time. So that hemostasis can be applied by people with less experience. It can be applied easily, quickly, safely, effectively out of hours, and it does not also require very much expertise from the assistant in that situation. So it has many advantages in acute situations which do not occur during working hours, and therefore potentially there are not people who are skilled at interventional endoscopy procedures available. So I think you should use hemostatic powders for acute indications when you feel, as the treating doctor, that you cannot control the situation with other modalities. For example, you have a duodenal ulcer that's bleeding. You are struggling to achieve a stable position. You're struggling to direct either heater probe therapy, injection therapy, or over-the-scope clip to the ulcer in question. Maybe it's in a difficult position. Maybe there's a lot of blood around. At that point in time, if it's out of hours and you want to make the situation safe, hemostatic powder is an excellent choice to acutely control the situation so that you can make the patient stable and then bring the patient back for a potential definitive procedure within 24 to 48 hours. Certainly, hemostatic powders work. Certainly, they work for a short period of time, but they absolutely do not provide a definitive solution to the patient's problem, and therefore, it's always important to schedule a relook endoscopy after you've applied hemostatic powders in the acute situation.